Moving on now, having won the Reader's Choice for Best Hearing Clinic 2 years in a row, it's clear that Arizona Hearing Specialists is making a difference in people's lives, and believe it or not, with their mental health. Audiologist and owner Dr. Greg Swingle is here to explain this surprising connection. It's so nice to have you back here.
Thank you. Good to be back.
Such a pleasure. It's always good to talk about hearing and making sure that we protect it, because it's one of the most valuable senses we possess. And so hearing loss has a lot of secondary effects, one of which might actually be dementia, right?
Yeah, so like you mentioned, hearing is really our way of kind of connecting to people in the world around you. And when you have hearing loss, you start to adjust for that. Really, it's something that we refer to as listening effort. You don't hear as much in terms of what people are saying or what's going on around you, and so you have to put more effort and energy into figuring out what's happening around you, or figuring out what people are saying. So it's nice that the brain does that, but at the end of the day, your ears are supposed to be doing that for you. So there's a very obvious connection between your brain and your hearing. And the thing is, when you start to lose your hearing, then you're putting that listening effort more and more and more out there. And there's been a lot of research that's been supporting this concept of as you have to put more mental effort towards just figuring out what's happening around you because you're not hearing as well, the greater the hearing loss that you have, basically there's a greater increase of your risk of dementia or cognitive decline. So it's really one of those secondary things that we don't necessarily think about specifically tied to hearing loss.
Right.
But there's definitely some evidence out there that's suggesting that they are tied to each other.
Yeah, and to simplify it, does that mean that you sort of start becoming separated from the world around you in a sense, and that's what sort of causes dementia? Is that sort of what's happening when you lose your hearing?
Possibly. I think there's still plenty of research to be done regarding what exactly is happening there. For example, there's always a very, scientists, researchers are always wanting to make sure they understand, is this just something that happens kind of coincidentally? So the same types of things that cause hearing loss also tend to cause dementia? Or is it actually a cause and effect kind of a thing where you say, well, because of your hearing loss, you might have an increased risk of dementia? So at the end of the day, like you said, when you can't hear as well, then you end up kind of isolating yourself.
Yeah.
And that's not a good thing for your brain at all, because we're a social people. And so when you're isolating because you just can't hear, you can't follow the conversation, so naturally you go, well, it's not really that fun anyway, so I'm not going to do that anymore.
Sure. All of this to say that we need to tackle it head on, right? We can't let it get to the point where we can't come back from it, because once you do start losing your hearing, it's harder to get back to a point where you can hear well, even with devices, right? The longer you go?
Yes, actually, that's very true. It's a good point, and that part of why we were excited to be on today is it's October. It's actually Audiology Awareness Month and Protect Your Hearing Month, and that's something that we're always trying to talk to patients about, is be proactive about this, because the longer you go without being able to hear things, your brain actually adjusts to that, and you adjust to not hearing, and that's not a good thing. And then you end up having to put more mental effort into the tasks that you could have done with normal hearing.
Right.
And so if you address your hearing loss sooner rather than later, then you end up not forgetting what that information was, because you didn't go very long without hearing it. So.
And I think there is a stigma, unfortunately, around hearing aids, right? I mean, people probably think about those big bulky ones that used to be out, and you would see people and sort of notice them, but they're way different. They're more advanced these days. They have so much more to them, including being able to connect to your smartphone, for instance. But what would you tell people who have this in their mind? Stigma.
Well, it's at the end of the day, I always tell my patients, yep, you can't hear quite like you should, and that's really unfortunate. And wearing hearing aids, nobody's going to be super excited about that. But at the same time, I don't think it's very fun to ask people to repeat themselves all the time either. And that actually is quite obvious to other people around you as well. If they're constantly noticing you're not hearing what I'm saying, well, that's also kind of a bummer too. So wearing a hearing aid can actually solve that part of things. And I just was talking to a patient the other day, and she was having a really hard time. I don't like the idea of wearing a hearing aid. It just seems like such a big step. Yeah. And I said, well, it's really not. It's just a matter of, like, if you didn't ever wear a watch and you didn't know what time it was, then you start wearing a watch and now you know what time it is. And so with hearing aids, that's all it is. If you can't hear the way that you should, and you start wearing hearing aids, then all of a sudden you're hearing a lot better, and it's worth it.
Same with glasses or contacts. I mean, honestly, hearing aids, we're hearing a lot, are going to be sort of the future of technology, of wearable technology to enhance the world around you. There's no shame in it.
Absolutely.
It's actually enhancing you as a person. So there's clearly a lot of good to it. And as always, thanks for being here and talking to us about it.
Thanks for having me.
Nice to see you. And if you schedule an appointment by October 31st, you're eligible for a no obligation hearing aid trial. And if you want more info, check out ArizonaHearing.com or call 520-600-EARS.